Shortall and Deputy Calleary.
Last night, Minister Roisin Shortall voted confidence in Dr. James Reilly, but it was clear from her speech and her remarks and the tone of her remarks, and the fact that she failed to mention the Minister's own name, that she doesn't have confidence in the Minister. It was pretty clear that not only did she not mention her name, but she outlined in her speech a series of issues that are of concern to her and within her priority were not being progressed within the Department of Health. It's hardly a sign of her faith, not just in Minister Reilly, but at the entire government machinery. She outlined her concern, and it's a direct quote, about the lack of priority afforded to producing the free GP care legislation, which is one of your commitments in the programme for government. She's also concerned about the introduction of universal health insurance. And after 18 months as a government minister, Minister Shortall is still asking very basic questions on what model universal health insurance will be based on in this country. So either from that we can deduce that there's been no work done in the area, or that the Minister has been excluded from any negotiations on the area. And she is the Minister in charge of primary care. I would like to ask you this morning, have you ever had any discussions with Minister Shortall about her working relationship with Minister James Reilly? Has she ever discussed her concerns that she outlined here last night in her speech with you? Has she ever discussed the concerns in relation to the delays in her being given delegated powers with you? Or have you ever taken it on yourself as the leader of your party and as Tánaiste to discuss what is very apparently a broken working relationship in the Department of Health?
Thank you. Tánaiste.
Civil war in the Department.
Yes, I heard the contribution of Minister Shortall to the debate last night, as I heard the contribution of the Minister for Health, Minister Reilly, and Minister Kathleen Lynch. And I also heard the collective voice of this House, which voted by a margin of 2 to 1, and every government deputy, commending the Minister for Health for the reforms that have been undertaken to date, more in 18 months than you did in 14 years when you were in charge of the Department of Health, and supporting the reform programme that this government has in health. And what we have heard from this government and what we have seen from this government over the course of the last 18 months is an urgency and an impatience to reform our health service with less money and less staff than you had available to you. And I expect, and the country expects, that those reforms will be delivered. And I do so because, while you may wish to make a political issue of it this morning, out there somewhere, there's a mother with a child who has a nasty cough, and she's wondering whether she can take that child to the doctor. And that's why, for the first time, we have a government that is committed to introducing a system of universal health insurance with equal access to care for all, and under that system there be no discrimination between patients on the grounds of income or insurance status, and the two-tier system of unequal access to hospital care will end. That's what we're committed to in our programme for government, and that's what we're going to deliver. And yes, I have discussed the delivery of that several times with Minister Shortall, Minister Health, at the relevant Cabinet subcommittee, and with my colleagues. And I want to assure you we are determined to deliver on that commitment, and I expect and I have confidence that the ministerial team in the Department of Health will do that delivery.
Thank you, Tánaiste. Deputy Calleary, without interruption.
Once again, Tánaiste, you failed to completely answer the question. You have the gall to come in here and speak about, I mean, this is a direct quote, an urgency and an impatience. An urgency and an impatience. And Minister Shortall said last night that she had concerned about the lack of priority afforded to producing the free GP care legislation. The Minister in charge of it says that not enough has been done for that mother with her sick child. And you speak about an urgency and an impatience. What have you done to address the completely fractured working relationship between Minister Shortall and Minister Reilly? What have you specifically made any intervention on a constructive basis to ensure that she has the support, that she has the delegated powers in order that she can do the job to help that mother, to help any mother or any patient get the GP care? Because she's in charge of the job, but she feels she's not getting the support to do the job. So don't come in here and talk about an urgency and an impatience when the minister in charge of doing the job feels she cannot do the job.
Please, thank you. Honestly. Would you mind asking your assistant here to stay quiet? Honestly.
Show him the door. Show him the door.
Thank you.
Show him the door.
When it comes to gall, Ceann Comhairle, Fianna Fáil has it in abundance. After 14 years, after doubling the expenditure in health, doubling the numbers of people working in it, you ended up leaving us with a health service that was worse than when you got it. And we are in the process. This government is in the process of repairing that. We have a strong team in the Department of Health, led by Minister Reilly, Minister Shortall and Minister Lynch, and they are getting on with the job of repairing the health service that you broke, and they are going to deliver on that. I expect that they will deliver, and I'm confident that they will deliver.
Thank you.